Malolele, Dalafalava, Kiorana, Maloni, warm Pacific greetings, even though it's a little cool. Tanakoto, 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 Katoa. Thank you for coming out today. For us to stand united this afternoon to ask our members of parliament to vote against the end-of-life choice bill this evening. My name is Dr. Ate Moala. I am Tongan, Matema Tonga. I have been working as a medical doctor for over 30 years here in New Zealand, in Tonga, and in the Pacific. It's a great and important day for Aotearoa, New Zealand, that we representatives from all walks of life are gathering here peacefully because we are united against this bill, this assisted suicide bill. We gather because we still have major concern with this bill, even its final version. I, as a Pacific leader and a doctor in my community, join the many tens of thousands of people who've made submissions to our Parliament Select Committee. We're saying to our members of Parliament, this bill is not good for Aotearoa New Zealand. It's never good for Aotearoa New Zealand. Come on. We are here today because we are concerned about the people of Aotearoa. We are concerned about the vulnerable, as Claire and Vicky have clearly outlined. Not only are those with disability, those are patients who are terminally ill, those with mental illness. These ones are vulnerable to this bill, and it's never good. These vulnerable Kiwis include Māori and Pacific people, my people. We are concerned about the implications of this bill if passed for the future of healthcare delivery in New Zealand. We are concerned about the patient-doctor relationship and the pressure that it will place on healthcare providers and healthcare organizations. The hospices of New Zealand doing such a fine job looking after people with terminal illness and those with irreversible condition. Don't let anybody tell you otherwise. We agree wholeheartedly with the views that is being endorsed by the World Medical Association that medically or physician-assisted suicide and euthanasia, it's unethical, even if they make it legal. As medical doctors, and I've got so many of my colleagues here today, thank you for coming out. Thank you for the nurses. Thank you for the health professionals. Yeah, thank you. Thank you for coming out. We believe our role should remain focused on saving lives and providing care for our patients and for those who are dying. This bill will weaken the doctor-patient relationship, which is based on trust, always on trust and respect, always on trust and respect. We oppose shifting our care paradigm from life to creating and perpetuating a culture of death through this bill. One of the concerns is this bill proposes to legalize only one means of death, the administration of a lethal dose. There's so many still in the public. This is not about turning off life support, as Renee has said. It's not about withholding treatment. This is about killing. This is about, assisted suicide. It's not good at all. As we've heard from Claire and Vicky, the vulnerable members of our society they will be at risk. We need to protect them to live and to die with dignity. The bill will put them under pressure, as Vicky and Claire have said. They may feel their burden to society and to families if they choose to live. One of the other concerns is that this bill is focused on just one individual. Who does healthcare for one individual? As a Pacific doctor, when Pacific families come and see me, we just don't do an individualistic approach. That is so dysfunctional. We live in families, we work with families. This bill just focuses on one individual and alienate the family. It is unsafe for families, it's unsafe for New Zealand, it's unsafe for Māori and Pacific and all of us, the millions of people in New Zealand who do life as families. As you know, Pacific people, they they are disproportionately, they suffer because of poverty and poor access to healthcare. They still the Pacific people and Māoris, they still trust doctors. Yay, they still do. But imagine if the doctor get under pressure to give the lethal dose because of, if they've been robbed of their conscientious objection. Come on. We need to just endorse and let's just let everybody know that we have excellent palliative healthcare service here in New Zealand. Thank God for the hospices. Thank God for the geriatricians. Not long ago, in 1905, my older sister, she suffered from breast cancer that had spread. The doctor, the very good doctor, gave her 3 to 6 months to live. She lived for another 5 years. It's important that everybody know that we all make mistakes. Doctors and healthcare workers, their prognostication could be wrong. They're not gods. But this bill will put people at risk. What if my sister took the lethal bill and missed out on another 5 years? We had the privilege to care for her in my house, in my family, with the excellent support of the hospices. We had time to sing and to share and to tell stories and to thank her and say our goodbyes. The next generation, the children, had a chance to care for her as a grandmother. As you know, the most important time is when the time of death, when we say goodbye. We tell the stories, we say things that had never been said. What is this individual? Was just her and this doctor who's going to give her the lethal dose. Never get a chance to come together with us as a family to talk, to share the memories, and to give thanks. I think it's important. All of us, my story is the same with all of you. It's not a different story. It's a story that we love to celebrate, caring for those who are vulnerable. The story from Netherlands and overseas is that once you open this door to this bill, it's very hard to turn it around. May God bless New Zealand. May God bless our MPs and give them courage. As they vote tonight, we just want to honor the MPs who've come out, Alfred and the MPs. Thank you for coming out today. God bless New Zealand. Thank you.